I have a good friend of mine, Bryan Laskin, with us today. Bryan is a dentist from outside of Minneapolis, runs a very large, successful practice up there. I've gotten to visit it once or twice. He also is the founder of OperaDDS, which makes a variety of software products for dentists that many of our clients use. Every time I talk to Bryan, he's got something new up his sleeve. He's working on something else. I don't know how he does it. I don't know how he has the energy for this, but today he's going to talk about something new with us again as well. So today we're going to talk about teledentistry. I know this is a topic that's quite on fire lately, as dentists are legally prohibited in many areas from practicing real dentistry. So how can we do it virtually? So let me introduce Bryan Laskin. Bryan, take it away. Tell us what you think we should be doing, or what the dental industry should be doing for teledentistry, and how anybody who's a customer or an audience member of great dental websites could benefit from such a product or service.
Well, thanks. Yeah, appreciate the kind words. You guys are doing great things at Great Dental Websites as always, which is amazing. And so I think teledentistry. So we've had a teledentistry application baked into OperaDDS for about a year and a half, 2 years, and it was an application that everybody was interested in, but people were kind of, everybody's busy in dentistry, so it was kind of the last thing to actually get done, and that's obviously been catapulted to the front of people's consciousness in dentistry right now. And so there's a lot of myths on what teledentistry is. To break it down, I like to put teledentistry into three big buckets, which I'll explain in a bit. Um, but but I think it's important to understand that teledentistry is a very broad term, which is basically how do we communicate with our patients when they're outside our office and it doesn't fall under secure email, really. And it's not different than other types of communication like what we're doing right now, right? So what we're doing right now, because you're in Denver and I'm in Minneapolis, is a web conference, right? That's everybody's doing a lot more of this these days as we're hunkered down in our houses, um, and this is synchronous communication. Well, you got to because you and I are both in our office,
You,
right?
you look like you're in some sort of fallout shelter
Yeah,
in a
this
basement.
is, well, that's half true. It's my office, which is in the basement of my building, on the lower level. But yeah, I don't have the most decorative background for people, unlike you. You have a beautiful office, but and nobody else is here, as nobody else is there. So still, I like telling people that social distancing is best when I come to the office right now. Um, but the big picture, what most people think of when they think of teledentistry is they think of what we're doing right now, synchronous communication. And I don't know about you, Jeff, but I like talking to you, but I would rather not talk to you in this format, and most people don't. And usually when I'm talking to people about teledentistry, I actually send them a link to a web conference, and then they call in and they go, "Well, why don't people like synchronous communication?" And I say, "Well, why don't you turn on your web camera? Because right." And so the sort of dirty secret is that we don't want to talk to our patients when we're not in our office, and they don't want to talk to us. Most people have dental anxiety. They don't want to talk to their dentist when they're on, and it takes longer than the second form of communication, which is asynchronous, like texting. So you can think of it as like texting or Facebook messaging versus Zoom conference or Skyping, right? And any dentist that's been out of dental school for more than a couple weeks can take a look at a photo or a video of teeth and have a pretty good idea of what the patient needs to have done, and getting that, and then on your own time responding to patients in a secure fashion is what I think is best for most dental practices. I think that the reason why people think of teledentistry as synchronous communication is because of the name. It sounds like web conferencing, but it doesn't need to be. And for most offices, it most of the time it shouldn't be. Now, if you're sending a hygienist into a nursing home and you have to collaborate with him or her on care, synchronous is the way to do it. But for emergencies, for virtual consultations, where the goal is the goal here is to bring with asynchronous and synchronous dentistry. The goal is the same, where you're trying to bring the patient into the office for care. which leads me to the third category that I like keeping separate. This is sort of Brian's way of thinking, not anybody else's, and I put it as definitive care. And what definitive care is, you're actually coming to a final diagnosis. You're planning treatment planning, even providing treatment without seeing the patient. And that was popularized by a little company called Smile Direct Club. And in response to that, many of the states are going, hey, maybe this should be regulated, because it's nice to know that where we move teeth, there's bone, right? I'm not an orthodontist, but I do a little bit of clear aligners, enough to know that's an important thing, and that it's good to have somebody overseeing that treatment. And so I personally feel that having regulations on teledentistry is great, and that's where the communication gets really muddled with people. They say, I can't do teledentistry in Texas. You can, you just can't do definitive treatment, and you may be restricted in whether or not you can bill for it. Now, the ADA has created two teledentistry codes: D9995, which is a synchronous code, and D996, which is an asynchronous code. And then during this COVID crisis, they've actually, a bunch of insurance companies have said, well, we'll actually cover these codes when combined with another code like a D0140, which is a limited exam. So if you're in a state that allows for teledentistry, you can bill a D9995 or a D9996 with another code, and you'll get paid for the other codes by insurance companies. Are starting to do this. Like in the last 2 weeks, they've gone from zero to, like, last time I looked, it was over 21 insurance companies, and it's growing all the time because it makes sense for everybody. However, in some states, you might not be able to bill for it. So I would check with your state regulations. In Minnesota, we can. And so it's a great way for dentists who are sitting at home. Number one thing they're doing right now is binging Netflix when they're, and so if you get a bing on your phone, you can take a look and go, oh, that person needs to have a crown. And then you text with them, hey, you can't say you need to have a crown because that's definitive treatment, right? But you can say, boy, it looks like your tooth is broken. I think we should get you scheduled for an hour. If you don't have, if you don't have pain, I can see you when our office opens for an hour and just get it done, right?
Yeah, that tooth is obviously missing. I can't say for sure you'll need an implant, but
Yeah,
trending that way.
exactly.
So
Yeah.
that's very important, because that seems to be one of the few non-emergency aspects of dentistry that dentists can legally practice right now. And I know we have a lot of clients whose businesses have been devastated by this, and their incomes, have been decimated. And this is a nice thing that they could do in the meantime, to supplement it, and in addition to set up the recovery, because it would be like, I'm expecting some sort of backlog of dental appointments from people who are just having issues that aren't emergencies, but they need to get treated for, but they can't right now. And the longer this goes on, the longer that backlog will build up. But it would be nice to try to get as many of those kind of squared away and on deck for when the practice reopens, so you can go back kind of with a bang. Are you, and I'm assuming you're already using this program yourself. Have you had many patients take you up on that yet? Have you treated anyone over the phone?
Oh yeah. I mean, we've
Okay.
been doing it for a couple of years,
This
and
is old hat.
well, to be fair, I created teledentistry out of pure 100% selfishness. I was at my son's baseball game, and he was up to bat, and a patient called me. I took the call, went away. He got a double I didn't see, and the patient just needed to be reassured. And I was like, "This is moronic. Like, why don't we have it so people can send us photos?" And so I went. That's what we did the next day. We created teledentistry in, like, less than a week, because of how OperaDDS is set up. It's a comprehensive communication platform that's HIPAA compliant. For us to do it was very easy. Um, Easy from, if your thing is developing technology, right? So we've been doing it. So not only I did it so purely selfishly for me, and it's been fantastic, because then when you see the tooth, you go, oh, I'm not going to waste your time and my time and have you come in for 15 minutes on Monday and then go, oh, guess what? You need to have a crown. Let's schedule you for a few days from now. I'm going to see, oh, this person needs a crown. I'll schedule them for an hour and get it done. Right? It's way more. Uh, way more productive.
I would certainly appreciate that as a patient, not having to come in for it's like, especially if I knew it. Like, yeah, my tooth is gone. I need an implant. Oh, yeah, duh. Thanks. Now I got to come back on Thursday. Awesome.
But
That makes a lot of sense to make it more efficient like that.
But here's the thing: is that patients have no idea what the hell's going on in their mouth, right? So, as talking to a patient is a horrible way to triage emergencies, right?
Yeah,
Because
yeah,
they
it
don't
hurts.
know. Yeah, well, my very first emergency patient was number 31 that was the problem, needed to be extracted. She thought it was number 2, so she was trying to crank on it with a pliers to get it out. So I actually had to end up doing endo on 2 and extracting 31. So
You had a patient using pliers to try to remove her own tooth.
yeah,
Oh my
Th-
god.
this is when I was a baby dentist and had more hair, and it was black.
Yeah, you're
Yeah,
preaching to
but
the choir here.
but the I mean, so and here's the other thing: is that if a patient needs to be reassured, let's say you're at home on a Saturday and you get a call, and the patient says, "I chipped my tooth. I need to come in," right? And you say, "Oh, does it hurt?" And they say no, and you go, "Well, is it rough to your tongue?" No, and you go, "You'll be fine till Monday." You sound like a jackass. But if you, but if right, but if you say, "Oh, I'm really concerned. Let me see," then the patient sends you a photo, and you can say, "Oh, I can see exactly what's going on. Uh, that your tooth is chipped. It's no big deal. You had a whatever it is. We can take care of you on Monday." And I guarantee it won't bother you over the weekend because you can see it. Uh, maybe you can't see a guarantee, but you can say, I would be very surprised, and if it does, give me a call back, right? Well, you've the patients are reassured at that point because you've been able to see what's going on. It's a whether or not you bill for teledentistry, it's delivering better care more efficiently, more profitably. Now, if you are in a state where you can bill for this, uh, and looking at a photo for 5 seconds versus having a video conference with somebody, right? It's gonna you're gonna be way more profitable. Billing for $100 exams where all you're doing is looking at a photo and saying, "Yep, the tooth is broken," and whether or not you see the patient.
So I'm assuming this the service is available in all 50 states. What about other countries? Canada, Australia, New Zealand. I know we have clients in those regions. Is this available there or just US?
Well, I'm sure there are. We Opera DDS is only available in the United States because we're HIPAA compliant. We're not PAPITA compliant. Most other countries require, basically the difference is that they require to have the data stored in the country of origin,
Yeah.
and we don't. We all our data centers are in the United States of America, but I'm sure that there's asynchronous teledentistry providers that that follow the regulations of your region that I would look for either a solution that has asynchronous or both. But the big one is the asynchronous store and forward. It can also be called type communication, where importantly, I think I'm kind of rambling at you versus having a conversation with you, but one big piece to not let slide when it comes to teledentistry is documentation. It's very hard for dentists. It's a big issue in dentistry that we collectively, myself definitely, uh, uh, don't keep accurate, complete notes all of the time, and
Mhm.
that is exponentially worse when you're not in the office. And so, look for a solution that allows you to write directly back from that solution to the chart note, or at least make it easy for you to do it HIPAA compliantly, because it's easy to let that slide. And especially if you're billing insurance companies for these teledentistry visits, you should definitely document it.
So I thought I had read that the government had waived all the HIPAA requirements for telemedicine, which I would assume included teledentistry. So is that not completely true? Are there caveats to that, or can you just do whatever you want over Zoom calls now?
Fantastic question. Uh,
Well,
so
thank you.
the I just did a podcast on this episode because it's like I'm trying like I'll try to not scream from a soapbox too hard here, but I think it's the worst thing that they did in this. Like I think it's completely moronic what they did. But here's what they did. They rolled back some of the guidelines for 90 days so that you can use tools like Zoom and some tools not all tools. Some tools like FaceTime and WhatsApp and uh, Zoom to triage uh, to triage for dental for teledentistry. Right. Here's the problem with that is number one, dentists don't understand HIPAA to begin with, right? So understanding the nuances of how what's been deregulated for 90 days is completely irresponsible in my opinion. Number two, what are you going to do day 91? Are you going to go? You never did this beforehand, and I've been doing it for 2 years, right? So you're going to switch your entire team and patients to a different solution? Makes no sense. Our application, as I told you at the top, you can sign up for OperaDDS for free for 2 months. So by the time you're on the other end of this, it's going to be free. There's no software to download. For patients, you can text them and they can communicate with you. It's stupid easy. It's easier than these other solutions, because what if you decide to use FaceTime and the person on the other end is an Android user, right? It's, I mean, the number of issues of what they did is all it's doing is adding confusion and making it harder in 91 days for people to actually comply with it. And the toothpaste is out of the tube, right? Once we start doing teledentistry, because it's so much better in every way, people are not going to want to go back to the old way, especially patients. So you get them used to this, and then you like yoink it back. And I think it will be because I mean, look, it's not like patient privacy suddenly doesn't matter because there's a pandemic, right?
Mm.
And so if you, let's say, you have somebody like that, it's just as somebody who actually cares about privacy and security. Uh, look at like what Zoom is going through today. I don't know if you saw that, but they're getting investigated by the feds because they've been leaking everybody's information, right? Uh,
Ah,
so you think
lovely.
this? So you think this stuff is going to go well? I mean, because the government said, oh, for 90 days. Like, I mean, look, I understand politicians. They have to. It sounds like they did something good, right? But all they did was create a mess for those of us that are doing it the right way. And the people that in 91 days don't want to be breaking the law.
Yeah, I think the only advantage that I could think of was, well, there's some free options that people can use, and they may already have them on their phone.
Hmm.
But the fact that your solution's free for the period that would last, kind of invalidates that point. And I think you're right about. I think there's going to be a number of like societal changes that happen after this. I remember when the beginning when everyone's like, oh yeah, you just touch elbows and you're magically safe, or like tapping shoes. I was debating with people whether or not we'd like end up losing the handshake if this became like an annual thing as a
Hmm.
greeting. But it wouldn't shock me if people became a lot more accepting of this, especially the use case you gave about, oh, I got to come in for 15 minutes just for you to confirm what you already know, as opposed to just schedule the hour with the presumption and have everything ready to be treated. That's a much better, more efficient experience. The other question I had was, are there any dental issues that if you hear it, you know right away that it's not going to work with teledentistry? The patient said, or specific procedures or dental issues that are just not going to work at all for teledentistry.
Well, yes,
And
a
anything that
ton.
required an X-ray, I would imagine that'd be hard.
Oh yeah, yeah. I mean that's why I'm a firm believer in not doing definitive treatment through teledentistry, right? I think that frankly the ADA missed the ball when they came up with the coding. I don't think it matters if it's synchronous or asynchronous. Who cares, right?
Mhm.
We're just passing information at the same time. That doesn't matter. If I were asked when I created these about those codes, it should be definitive, right? And pre-diagnostic, right? And I think that uh, it doesn't look. There are times when you have to do teledentistry, definitive treatment, if it's in a nursing home or in a remote area and there's no dentist around. But like you're not going to excavate a cavity through Zoom, right? You're not going to be doing a root canal over
Just tell that woman
FaceTime.
with the pliers to put them
Yeah,
down, down.
I don't think you should do
Come on,
ortho,
Stacy, down,
right?
not up.
Yeah, I don't think you should do ortho without seeing somebody, right? And now that's a wild stance because it's one of the biggest companies like in dentistry right now. And so, but here's the reality of it
They'll check their
uh,
stock price when we're at it.
well, yeah, well, it went down.
Yeah,
Uh, I
I think everything
I
did.
yeah, yeah. Yeah, that's not a fair judge.
Let's
But
bought some
here's what,
Costco stock.
yeah. Well, here's what I would say though is that like I believe the reason why that exists is because we didn't get ahead of what patients wanted in the first place, right? A decade ago, I dented my fender, took a picture of it, sent it to an auto body shop, and they told me right away, "Oh yeah, it'll cost you $1,200 and it'll take us a day." So I went over there and got it fixed, right? No dent. I mean, we've had that for 2 years with an OperaDDS, and the number of people that leverage that is very small. Now, I'm not, but because we don't look at things from the patient's perspective, right? And the patient's perspective has always been that we should be doing things this way. It just wasn't readily available. Now that it is readily available, patients will be demanding it, and they were before. That's why Smile Direct Club got to be so big, because people wanted this teleservice to be done. We didn't take control of it and do it in the way that I, as a dentist, feels probably responsible. Um, Responsibly done. We didn't regulate it. We didn't standardize it, and so private company came in and exploited it, right? Uh, and that and then we're like going, whoa, why is everybody using this service? And it's like because it's what people want to do. I think as an industry, we bear a responsibility to be ahead of these technologies to on the behalf of our patients personally, and that's why we try to create all this technology and stuff to advocate for patients from a dentist perspective.
I think that's well said. Smile Direct Club, if there's anybody rooting for Schadenfreude at home, is down from its high of 20 at 416, and it was kind of coming down a little bit before this started, but it's collapsed quite a bit. Unlike unfortunately, like the rest of our market. Back to teledentistry though, for the asynchronous, I think the synchronous thing is pretty obvious. It's kind of like what we're experiencing right now. But are you able to share your screen and give us just a quick look, maybe like the 2 minute demo of what the asynchronous experience looks like? I'm imagining
Sure.
it's kind of like text messaging with pictures.
Exactly. Let me pull something up here because you would have thought that I would have like had this all queued up,
And while you're
but
waiting,
of
what
course you'd be
after the
wrong.
trial runs out, what will this cost any clients looking at home thinking about adding this to their practice on an ongoing basis?
So for emergency triaging, it's $89 a month, but that includes like,
This is cheap.
oh yeah, and then for virtual consultations, it's $149 a month, which
Uh-huh.
includes there are parts of packages that have a whole bunch of other features.
Is that additive or 149 includes the asynchronous thing?
It includes it.
Okay, so the
Yeah.
149 includes both the synchronous and the asynchronous.
We do right now. We do all asynchronous.
Okay,
Next week we have a synchronous platform launching. So because
you heard it
people
here
want it,
first. We're breaking news.
it's true. It's true. It is true. Well, here's my screen share. Uh, but um, so we will have synchronous, which will be. We haven't figured out the pricing yet. That's why it's next week.
What is that background picture? Is that like a zoomed in picture of a gorilla?
Let me. Can you see my screen? Okay.
I can see it now.
Yeah. So you
Yeah.
can see it's somebody taking a selfie with their teeth.
Oh no,
With their
I
teeth.
meant I saw the background of your computer.
Oh, that. Yeah. That's my little motivation. Yeah.
What is it?
It's a gorilla.
Oh, okay, yeah, I just saw the Jane Goodall documentary, so it's still fresh in my head here. All right, sorry for that distraction. Go ahead.
That's what. No. Um, Actually, I worked with I was a zoology major, and one of the professors I did a research study with actually studied with Jane Goodall for like 9 months when I was working with him. And yeah.
I wonder if I saw him. There's a lot of interview, or there not a lot of interviews, but like there's like B-roll footage of like the students that came.
Oh, really?
Yeah,
Oh, his
to
name his name
Gombe.
was Gubernick. Yeah, was who I worked with. But
They didn't
that's
mention
all.
anybody's name.
I went down the tangent farther. Sorry.
Yeah, it's all right.
Um, so this kind of goes over the old way of doing things that we fixed when I at at the fortuitous baseball game of my sons,
Yeah.
right? Where, where where typically there's a lot of documentation. Looking at your schedule, you have to call the assistant, go into the office, and it's a gigantic pain and ruins everybody's weekend, right? Um, so versus if this guy has a chip on his front tooth, takes this photo, I bet every dentist there already is creating treatment plans in their brain within 10 seconds, right? Even from this horrible photo from like far away, I can tell you the options that I would probably, the questions that I would have to ask, like, is the pulp exposed? Well, he's smiling and pointing at his face like this, so he's not in pain, right? So I mean, we can come up with treatment plans very easily, right? Let me get to the case of it. So this is a more common dental emergency where, like, if this little girl's bracket comes off, the first this little Sally here just had her 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 brackets bonded on, and then they go home, and the next day a bracket comes off. She goes, "Mom, my braces are broken." Right? Mom freaks out, calls, and if you say, "Ah, you'll be fine till Monday," right? Again, you don't look like the most compassionate human being, even though you know that they'll be fine till Monday. But if you take a look at it, the photo, and you go, "Oh, Sally's bracket just came off. This happens all the time. Uh, either they either stick or they don't, and if they don't, we'll just take care of it next time she comes in." Right? It's not a big deal. So you can like Dr. Pint here is just looking at the photo on her phone, triaging that emergency. Um, this is kind of what the forms look like. You can see that you have this is a four-part form that's created for this TMD emergency case. We have a bunch of different forms that we create on your behalf, including virtual consultations. And you can see on the right that we have this form builder, so you can build your own too. If you don't like our questions, if you want to add to the if we don't have how far can you open on the TMD disorder form, you can just quickly add that. Our forms are super easy to use anywhere, so you can have them on your website, you can text them, you can email them to the patient. So if you're not by a phone, and I don't know how you'd be by a phone and talking to a patient, but let's say you were, you could say just go to
Just
our
yelling
website.
via social
Yeah,
distance.
yeah, you're right. Hey, go to our website. The form's there. Or you could text or email them, and it just takes them to the form. In cases of our virtual consultations, it shows you, kind of walks the patient through. This is an ortho consultation, so it walks the patient through which photos to take, and then so then you just take them, go to the next one, take that photo, that kind of thing. Uh, so it says, please take the following photo, right? And then you get the information on the other end. It gets uploaded to the cloud where you just log in, just a username and password, and then you get to view everything. Full HIPAA compliance. Like I said at the top of the webinar, we kind of split ours into emergency and virtual consultations, right? Um, and then it writes back directly into EagleSoft, Dentrix, or Open Dental. So if you open the patient's sort of their chart and send it off, that information will be automatically imported back into their chart. Or if you send it to them, it shows up. I'll see if it's on here. I don't even know it's in my demo. Um,
Lots of memes.
Yeah, lots of memes. Yeah, if you once you get into
That
the back
success
end of the
kid, he
software,
graduated college. I think I had seen, and there was like a picture of him like redoing it.
this
But
guy.
that's yeah,
Oh
yeah.
yeah,
I feel
is he
old, but
really? Oh yeah, that's
yeah, I believe so. I'll see if I can find it.
the but the on the back end of the software. If you don't have the patient's name when you send them the information, they you go into the OperaDDS. It says the name of the form, what that it was submitted with the patient's name, and then there's a little button that you click on. You can search the patients, and then so you link that patient name to the actual form, and then it goes directly into the practice management system. And so I'm always amazed at the amount of scanning and shredding and downloading and just useless labor that we force our front office um, staff to do in regular times, but right now this isn't a possibility. So doing it virtually is the only way to do it. Um, and so that's kind of an overview of Opera DDS's teledentistry solution, which like we said before, I'll go to here. So operadds.com. If you there's a sign up form and there's a little live chat that you can talk with somebody, uh, where you can have your questions answered there too. But we're giving away during the COVID-19 crisis a couple big things. One is a teledentistry for 2 months, and then that also includes something we didn't talk about, which is a pre-screening form. It's very vital right now because before you see patients, you should ask them if they've been out of the United States in the last 14 days.
Have you been anywhere on Earth in the last 2 weeks? That's what it comes down to at this point.
Have you been outside your house in the last 14
Yeah.
days? Yeah. Uh, have you been diagnosed with COVID-19, and do you have any signs and symptoms of it? Right. If they answer yes to all three, send them to a medical professional first. And I when we started doing this, when we rolled out this pre-screening form for people, wildly popular. Like everybody downloaded it and started using it right away. And I was like, who's going to say yes to these questions and call their dentist? Every day I have a dentist saying, you don't believe it. Somebody said yes to all three questions and still wanted me to see them. So keep yourself safe. Ask people before they come in. So texting that pre-screening form may seem like a small deal, but just like that patient cranking on her number two,
What was their
thinking,
yeah? What was their emergency? I mean, did they just like lose half their teeth in like a 2x4
I don't know. I
accident or
haven't
something?
followed up with the people saying like, what was it? It's more like where I see it because I've been doing some videos and webinars like this about teledentistry, and there's always comments, right? And the comments, that's where I see it, where people are like, "You wouldn't believe it, I had one too." You know, where somebody was diagnosed yesterday with COVID, and they wanted to come in because they're some like a non-emergent dental issue. And right now, I should say, I was on a webinar yesterday where somebody said 42% of emergency visits to the hospital right now are dental emergencies.
Oh,
42%.
geez. Are
And I
you?
just
By the way, are you going to share anything more, or should we bring you back to full
let's bring
screen?
it back. Let's bring it back to
Yeah.
full screen. So I'll stop
Uh,
sharing.
I've seen that there's been a lot of I'll dip a toe into this moral issue, but I've seen a lot of I don't want to call it grandstanding, but a lot of people who are concerned about the morality of dentists staying open, and I'll let each dentist make their own determination for that. But I think with the emergency cases, I think there's almost a moral imperative to see patients that aren't actively infectious because you're relieving the pressure at the emergency room, and they have their own problems to deal with. The more that dental emergencies, legitimate dental emergencies, can be seen in a dental office, is the less that somebody who's trying to treat COVID patients, or you're not taking a bed away from somebody who might have come in with a COVID diagnosis, or exposing your patients to possible COVID infection. I
Yeah.
would not. I remember telling my kids like, easy with those like stunts on your bikes right now. I don't
Mhm.
want to have to take you to a hospital. Um, I think that's something that everybody should bear in mind.
Yeah, and I don't. I think it's important. I agree with kind of what you're. I agree with you what you said. I do think it's a more complicated issue because there are a lot of dental staff that and dentists and patients that are freaked out right now of seeing each other in the dental. So I think what you said earlier, I could not agree more with, is that there's going to be a shift in our society in dentistry. You know, in the AIDS crisis, we started wearing masks and gloves. Turns out, it didn't do anything for catching AIDS or not, but we still wear masks and gloves today, right? And I think there's going to be a similar response after this. How I can
Little
tell you
hazmat.
how we do well, we might use disposable gowns. We're figuring out what that's going to be at my office, and I'm going to be messaging that in a big way because I think that it's important, right? Because I agree with you that we should see emergency patients, but the problem is how we saw patients 3 weeks ago was not the way to protect ourselves from what's going on now. So that's a different issue. But I don't think the reason why 42% of patients are going or the 40% of emergency room visits right now, or whatever that number is. That's what somebody quoted, which I thought was a lot.
It's some number, and it should be as low as possible.
Yeah, and I talked to an oral surgeon that comes to my office to ask. He's like, "Yeah, we're seeing tons. That we're at the hospital, we're seeing tons." But I don't think it's because dentists are refusing to see these patients. I think it's because patients don't realize that they still can rely on their dentist for emergencies. And so we're telling like OperaDDS customers, because we have a full recall system too.
Yeah.
Like, now is not the time to not communicate with your team or your patients, right? Over communicate. Let people know that you are there still for emergencies, because I agree with you. We have a moral imperative to take care of our patients, not just because we can't abandon our patients because of what's going on, but also because we need to keep them out of the emergency rooms, and let the hospital handle the the cases that are coming in that have to be seen there.
Yeah.
Yeah,
So everybody can find this. I think it's operadds.com.
correct. Yep.
What else would you like to leave with our customers viewing this, or anybody in the audience, or anything else you want to discuss?
No, I think it's pretty easy to get a hold of me if you have any questions or issues. Just you could, like I said, there's somebody on the little live chat. We almost always have a live human being answering calls there, or just shoot an email to care@bds.com, and we can answer your questions.
And it's free for the first 2 months, $149 after that. I think that's a great value. I think Zoom is an alternative held up, but I think the HIPAA compliant version of that, assuming that those legal issues that you mentioned don't pan out, but even still, that's I think like 199 per
200.
month, 200. Yeah. So
Yeah.
and that's just
Sorry, you said
video.
199. That was
S-
very jerky of me. You're totally wrong. It's not 199, Jeff.
I apologize. Yeah.
It's
So it's
$200.
That's half percent more. It adds up over years. But anyway, I think it's tremendous value. I'd encourage our clients to just take it for a spin. At the very least, you have nothing else going on right now, and this is especially if you're in a state that can service this or can code or do the insurance coding. You got nothing to lose, and you may as well. It'll help you keep a patient that may otherwise have just gone to the emergency room or forgotten about you. So thanks again for your time, Brian. I appreciate you coming on to talk with us and share all this information with our customers today.
Thank you. Appreciate it.